Board, Chairwoman Mary Amoroso, and the County Health Officer, Hansel Asmar. As many of you have been reporting, Broadway has gone dark. Disneyland has closed its doors, and the NHL, NBA, MLB, and NBA seasons have come to a halt. As the county executive, I feel that closing all of our public schools in Bergen County is just a paramount decision, and I do not take it or make it lightly. I've been fielding phone calls this week from mayors, health and school officials, and other leaders and parents about the status of our schools. While with the continuing spread of COVID-19 throughout Bergen County, it is imperative that we take action and do everything in our power to protect our 1 million residents. This includes our 75 school districts, which have almost 170,000 children, 16,000 teachers, and hundreds of administrative, custodial, and support staff. Earlier this week, I declared a state of emergency in the County of Bergen. As a result, we closed all 10 county-operated senior activity centers until further notice to protect our seniors, who continue to be the most vulnerable population when it comes to the spread of this deadly virus. We suspended visitation to our Bergen County Healthcare facility in Rockley, and our partner agency at Bergen Newbridge Medical Center implemented the same policy for their long-term care facility. We also announced that we were closing the Bergen County Technical Schools and the Bergen County Special Services Schools, which affects approximately 3,600 students and 1,600 teachers and administrators. Today, we are making another announcement concerning schools. After consulting with the executive leadership of the Bergen County Association of School Administrators and our county health officer, I have decided to have all 75 public school districts in Bergen County transition from on-site learning to off-site internet-based and paper-based distance learning until further notice. While the CDC states that COVID-19 does not pose as great a threat, a greater risk to our children as it does our older adult population, it is vital that we protect our children from the dangers of this virus or the community spread of this virus. We are confident in the ability of Bergen County teachers, staff, and administrators to successfully educate our children off-site and are encouraging them to begin preparing lesson plans as soon as possible. Unfortunately, this virus is not going anywhere for the time being. As your county executive, I will continue to take every step necessary to protect you and your families. In an ongoing effort to be safe, we must continue to take proactive steps to get ahead of this virus, contain the spread of this virus, and protect ourselves from this virus. You've heard many health officials say over the past week, but it bears repeating, there is currently no vaccine to prevent COVID-19, but the best way to prevent infection is to avoid being exposed to the virus. The CDC and the New Jersey Department of Health recommended that you take the simple steps that they have recommended to prevent the spread of COVID-19. We are also encouraging businesses to let their employees stay home using communication technology to be with their children to address their child care needs. And if not, If that's not possible, we hope and expect private businesses would make allowances to their employees to be paid for a reasonable time to take care of their families, similar to the civil service guidelines public employees have. The people of Bergen County are a very strong group of people, and we will get through this. We have made it through Hurricane Floyd and Superstorm Sandy, when schools were closed for days and weeks, and we will make it through COVID-19. We are Bergen County strong, but we must take steps to protect ourselves, and that is what we will continue to do with this most recent announcement concerning our school children. During this week, you heard me talk about the amount of phone calls. Today, when the health commissioner raised or made our risk level moderate, the phone calls increased dramatically. Not only to my office, to our public 911 center, to our Office of Emergency Management Operations Center that's been opened, to the health department here today, all over the county. I spoke to every mayor that has had a positive test result just this evening to let them know the decision that I was making. They are all in 100% support of that, along with their superintendents and the health officers. While I don't make this decision lightly, it is the right thing to do to protect our most youngest of people, our students. Also, this will allow the teachers to do the preparation they need to be able to teach and continue to educate our children, because that's what the plan is called for, to continue to educate our young children. At this point, I'll take any questions. Yes?
Does the online learning start tomorrow or Monday?
So the closure of school will take effect at 3 p.m. tomorrow. All schools after 3 p.m. tomorrow will be closed. So schools have tomorrow through the weekend, and then on Monday there'll be no children in the school, but certainly some of the school districts will have teachers and people in there if they need to do extra preparation for that, those teaching models.
What is the State Department of Education's role in this? Have you consulted with them yet?
I did. I spoke to the county superintendent who was in the commissioner's office, so they're aware of what we're doing, and that was the protocol. I had the superintendent of schools with me most of the day until he was summoned to Trenton about 2:30 to meet with the commissioner. So just about 5 o'clock, I spoke with the county superintendent, who was in a meeting with the commissioner, and he communicated that to the commissioner.
Have you spoken to the parents of the children that will no longer be in school? Have you spoken to, how they're supposed to have child care, if they're nurses? And I've heard statistics where 1/4 of all nurses are mothers. How are we going to have these children watched? How are we going to have, have we checked with the ramifications?
So this is no different than when we had Floyd or Superstorm Sandy, right? We were out of school for 5 days, 10 days. I was out of power for 14 days in Paramus, right? So it's no different than those times. This time we're actually better prepared because we can continue to educate the students, which we couldn't do back then. So we know that child care is a concern. You heard me address, I'm asking the business community to work with those that have child care issues, and hopefully they'll allow those employees to take care of their children and continue to pay them. Civil service has put out guidelines for every civil service, county and municipality, about how they expect us to treat our employees to address child care issues.
So children's and doctors and nurses specifically, those are the frontline people in this. How
Well, we will work with the municipalities, they will work with the municipalities, we'll work with boys club, girls clubs, we'll work with all other agencies. We have a human services department here in the county, just like we would in any other normal type of disaster or catastrophe. We will work with those folks to make sure that we can assist them in any way we can in making sure that they can help protect us and do the work that they need to do through this virus, but that they can be comforted that their children will be taken care of.
Are there any plans to continue school meals for kids that rely on those meals?
So each school district is responsible to continue those programs. That's in their plan. So whatever local programs they had, they're required to continue to provide that. When I was speaking with a couple of the superintendents today, they were telling me that they're dealing with their providers that they normally use to use at the school to provide the same thing, pickup times for certain age groups, pickup times for whether they use the alphabet or grades or whatever, but they will continue to supply all those programs.
Okay, so people would be going to the schools.
To pick up the meals and things like that, or maybe some will do a delivery service. I mean, I don't know. There's 75 school districts. Each one will have their own plan, but they're responsible to continue to provide those programs. Yes.
You said earlier that you had spoken to all the mayors from towns that have
Had a positive test
yeah,
result. Yes.
How many towns? How many mayors?
6,
Five
5 towns.
5 mayors.
Can you just give us an update real quickly? What is the status in the county tonight of the positive cases?
They haven't changed since this afternoon. Hansel?
We had originally 11. This morning we received 2 from the state that they notified us of. It's 13 currently. Now that number might change as we're having this conversation. Hopefully not, but I'm not betting on that. So we're looking at 13 at the moment. But this is something, this was not an easy decision, as the county executive said. We have to do this. If we don't do this, our numbers will continue to increase and increase. And we can't play defense. We have to play offense. I know it's hard. We've been mulling over this all day long about this. For days at a time. It's not something that we take lightly, but my responsibility is to protect the people of Bergen County, and I'll continue to do that. And that's really the reason. It's pretty straightforward. There's no magic bullet here. I wish there was. I can't wait 18 months for a vaccine. I can't wait for an antiviral solution. We have to do mitigation. If we don't mitigate, we're going to be in serious trouble. So this is the right thing to do, and I'm glad the county executive supports my decision and recommendation to do it. It's not my decision. I recommended this based on what we're seeing and what we've seen other countries do, and the ones that have done it have had better responses. The ones that don't, you end up in a level 3, and I don't want to be in a level 3. Thank you.
Thank you. Is there any indication, you say we're going to be in a level 3, is there any indication as to where we are now?
Well, I'm sorry, the state put us at a moderate risk level.
But that's internal.
That's internal for the state. Levels 1, 2, 3. That's national. I'm talking about just for us. I'm only concerned about right now the county of Bergen. I can't speak for the federal government, but I can tell you for here, we're going to do everything we can to get this done.
But I was saying though, for here, for Bergen County, where would you say we're at, a level?
Well, they ranked us. They're the ones who put that risk
The
level.
health commissioner ranked
Yeah,
us.
the state health department did that, not us. We didn't ask for a moderate. That's what they gave us. So we have, we were acting anyway. So regardless of what the level is, we don't want to play catch up on this.
What I'd like to do is have the Freeholder Chairwoman just address you in regards to the school closing. Freeholder Chairwoman?
Well, we have the technology to do it, and our school partners have been working hard to set up preparedness for this home learning, and it's absolutely the right thing to do. One of our new confirmed positive cases is a young woman less than 16 years old. So this sense that it's only affecting older people is being put to rue. So anyway, thank you.
Thank you. Any other questions? Yeah.
Can you actually name those 5 towns?
Sure. Fort Lee was the first town. Englewood, Teaneck, Little Ferry, and Bergenfield. Those are the 5 towns that have had residents test positive, presumptive positive, based on the confirmation of the CDC. And as you heard, we have a total of 13 as of this afternoon. What the number is right now, I know there were 37. There were 37 They were waiting on 37 other results to come back. So what those numbers are, I'm not sure.
Just to clarify that I have the numbers correct, you said 75 school districts, 170,000 students, right?
Correct.
Of those, and 16,000 teachers.
Correct. And let me just add that you heard me say, we're asking the private and religious schools to follow along with this directive. I encourage them. I hope they will. I believe they will. But I just want to point that out, that we are asking them. The Rabbinical Council in Bergen County did today shut all the yeshivas down and synagogues. So we know that that's already taken place. So this would be the rest of the religious schools and the other private schools that are out there. We would ask them to take the same action as we're asking the 75 public school districts to do that. Anyone else? Thank you all for coming. Thank you.